So are we, Athena or Melissa, one of you who has to start the recording so I can call us to order?
We're waiting on
Recording in progress.
Amherst Media.
Oh, now we're waiting for Amherst Media. Okay.
Okay, he's good to go. I'm still trying to get David, still trying to get Chief Ting in the meeting.
He's
I'll
joining
start
now
the
as the
recording.
panelist. He's all set.
Okay.
Recording
The recording
stopped.
started.
Go ahead, Kathy.
Good afternoon, everyone. Today is the May 15th meeting of the Finance Committee and our budget review. Because we're conducting the meeting virtually, my first order of business in calling the meeting to order is to make sure that the members of the committee can hear and we can hear them. I will just call on you by the order that I see you on my screen. Mandy Haneke.
Present.
Bob Hegner.
Present.
Andy Steinberg.
Present.
Tom Porter.
Present.
And Alicia Walker.
Present.
Thank you all for joining us. Bernie Kubiak let me know that he wouldn't be able to make it today. Our agendas are just so I see we have police and fire here. Our agendas are set up that we take public comments first. So I'm going to open it for public comments and then we'll get on with each of the departments. So if there's anyone in the audience that would, in the public attendees that would like to make a comment, please raise your hand and we will bring you in and allow you to talk. The person who is labeled Craig's Doors has been brought in, and if you'll tell us who you are.
Of course.
And you're welcome to talk. We limit the public comments to no more than 3 minutes, and we won't get into a dialogue. We will just
Great.
closely listen to what you have to say.
Thank you so much, Kathy, and everyone here. My name is Tim.
My name's Molly.
And I'm Orlando.
And we work for Craig's Doors, doing whatever we can to support our town's most vulnerable and disconnected community members. We're blessed that our community values this work enough to pay us to do it, not a privilege that everyone shares, particularly in these times. Homelessness is busy work, so we won't pretend that we've studied town budgets or finance. This is just a spirited appeal that the CREST program be funded by any means necessary. Local government is about voice and opinion, but also responsibility and participation. We only ask that anyone advocating for CREST to be defunded be entirely sure that they are familiar with the work, not the data, not the dollars, but the work and the impact on individuals that the rest of us in the community are unwilling or unable to show up for. Get some skin in the game and volunteer. Camille, I don't know if you're here, and I don't know if you have a volunteer coordinator, since so much of your energy has been spent defending and justifying the existence of your team and its mission. But we do. So come spend an hour a month and change someone's life at Craig's Doors and work alongside the CREST team like we do every single day. So much discourse around CREST has been reactive. It's anti-police, it's political. It was a response to a problem that doesn't exist here. I've participated in that discourse. I can't speak for other communities, but I can say from my personal experience, we do not have a police problem in Amherst. Chief Ting is a friend who is doing his thing, working to improve an imperfect institution just like Craig's Doors, just like CREST. What's killing people is a lack of community, a lack of connection. Let me be very blunt. If we walk away from innovative solutions to local problems, our community members will fucking die. That is not conjecture, that is fact. I work with them every day, and my lived experience reminds me that I am not only a partner, but a beneficiary of CREST services had they been available when I could have used them. Defunding CREST is defunding us, is defunding your neighbor and brother and cousin and mother's wellness someday, perhaps. Government is not a master of its people, it's its caretaker. CREST takes care of us. Please let them help, my friends, or we will die. I want to end with a quote from contemporary philosopher from Chicago, Mick Jenkins, quote, "You're either healing or you're killing," unquote. We're here to share our experience with CRESS. Please email us at volunteers@craigsdoors.org. And thank you so much for allowing us the time to talk.
Thank you for your comments. There are two other people with their hands up.
I'm Martha Hanner from District 5, speaking as an individual. Our safety departments have the job of protecting our residents, all of our residents. CRESS is just as important as the police and fire departments in this role. We do not see all they do because much of their work is preventative. For example, you just heard from Craig's Doors, the kind of work they do there, or similarly, the Survival Center, or local businesses, if they have some minor problem and don't want to call the police, they can call CRESS. Our schools, the work with teenagers in our schools. I have a neighbor who has such high praise for one of the CRESS responders who helped his son. So if an individual is distraught in a public place and a CRESS responder can calm them and transport them to a safe location, isn't that public safety? How much more CRESS could do if they were available from 4 to 8 p.m. as well. The well-publicized unlawful actions of ICE are causing so many of our local residents to feel vulnerable and fearful of any police interaction. Thus, our need for the services of CRESS's unarmed responders is more urgent than ever. If you were an immigrant with all the proper paperwork, wouldn't you still be fearful? A mere record of a minor police interaction could be used by ICE as an excuse to deport you. Yet the proposed budget cuts put CRESS below the threshold for safe and effective functioning. It's not just a 25% loss of responders, but elimination of the implementation manager. This loss was not even mentioned in the budget report because it was grant funded, but it's still just as much of a loss. It's like asking Paul to run our town without Angela Mills. And surely short-term bridging funds could be found to support the implementation manager until future funding is secured. CRESS already has a very positive impact. Yes, we need to reassess how we can make CRESS more effective, but let's not starve it to death in the meantime. Let's give all three of our hardworking safety departments the respect and support they deserve. Thank you.
Thank you, Martha. And we have one additional person. Deborah, you are with us.
Hello, hi, can you hear me?
Yes.
Hello, hi, my name is Deborah Ferreira. I'm from District 2. I want to talk about, and I'm talking as an individual. However, I was part of the original group of the Community Safety Working Group, CSWG, and I currently serve on the Community Safety and Social Justice Committee. And like Martha Hanner said, I echo a lot of what she said. But the CSWG, we recommended CRESS into existence in terms of its department. It is critical to the function of the town to serve all its members, especially during this time that we're living in. As Martha Hanna pointed out, ICE has been, seen in a variety of different places, not only close to where we live, but also in Amherst and in the other places in Massachusetts. The most vulnerable amongst us in our community are afraid. CRESS is there for them to be able to reach out to get the assistance that they need. They are very distrustful of other agencies that are armed, that might be collaborating with possibly with ICE. And and I'm sure that there's a lot of misinformation in regards to that, but they trust CRESS. Right now, the town is freezing 2 of its positions. And also, as Martha pointed out, there's the implementation manager whose funding is being cut. That is basically starving CRESS. It's diminishing their capacity. They're able to, as others have said, assist those who have mental health concerns, who have drug or alcohol abuse, and they can assist in any situation that is nonviolent because the other safety agencies would deal with any violent actions. CREST is critical to our community. It serves those most vulnerable, but it serves all community members. But I want to be specific in regards to serving BIPOC members, and us as a town should care about inclusivity, diversity, and equity in this town. Thank you very much.
Thank you for your comments. That concludes public comments. So I think we can start. I don't know whether you had a specific order in mind when you set this up, but I think the order in the book is the police and then fire and then CRESS, I believe, is the order. So we could.
And I will say, Kathy, that, yeah, the order that you have it is fine, with me. Camille from Cress, had a conflict with this time, so she is gonna be joining late. So it is good for her to be at the end of the meeting.
She's actually
I'm
with us.
actually here. I made it.
You made
She's
it?
here.
Okay.
Thank you.
She's very definitely here.
Well, she's last because she asked me to be last, so.
Okay, Andy, I see your hand is up.
Yes, I was gonna suggest that we ask Captain Young if Chief Ting is planning to attend, and if so, whether we should take fire first.
Andy, he's here. Chief Ting is here.
Oh, okay. So it's up to you, Kathy.
Well, the order in the budget book and the order of the questions as you sent them in, and then Mandy had some addition started, I think, with police. And some of them are cross-cutting questions. So if the way we've been handling this is responding to questions as we sent them in, but you're also absolutely, we welcome if you want to make opening statements about, how are things working in the police department, morale. One of the questions, as you know, was with one slot that was vacant, scheduled to be frozen. What does that do for staffing? So in any case, we welcome if you want to make some opening statements, and otherwise we can go into the questions that were sent.
I wouldn't mind beginning, if that's okay.
Yes, absolutely.
First of all, I just want to, I'd like to introduce Captain Ron Young and Captain Bill Menard, who are joining us. From my understanding, there's a lot of questions in terms of budgetary type questions, and these gentlemen are experts in certain areas, so I will call upon them to certainly speak upon certain questions. I do want to say that, currently with an additional position that's frozen in the police department, as well as the two that have been frozen a couple years ago, we are down to 45 sworn officers. At the peak of the department, we were at 1.52 officers sworn. So if you think in terms of how many officers we are down in that comparison, that's an entire shift. So it definitely affects us tremendously in many different ways. There's several other layers of difficulties that we certainly face within the police department. Certainly this profession has changed in the sense that, the demand is much greater now. So we have job openings all over the state for police officer jobs. There's the general public, they just don't want those jobs anymore. It has, it's a very complex issue, and there's a complex answer for that, which I don't think we have the time to really delve into. But I will talk about the Amherst Police Department. In the past 5 years or so, we have seen a departure of approximately 25 officers. They have left for various agencies. Some of them have been retirements, but the majority of them have left and gone on to other places for various reasons. Some of it is, the feeling that they get within the town and the department in terms of feeling a lack of support. Some of it is for financial reasons. So again, that costs us a lot of problems. I don't know if people realize, but it takes about a full year for us to go through a whole recruiting process to find a qualified applicant and to put them through the police academy, put them through field training, to get them out on the road. It costs us about $30,000 just to get them through the police academy, and in a year's time, anywhere between $80,000 to $100,000 for a rookie's first year. But they're leaving within 3 to 5 years. So the turnover rate is just causing us a tremendous amount of issues. It's taxing our officers when it comes to training. Each rookie officer that comes through, we have field training officers. It taxes them. It taxes our officers when it comes to forced overtime, which is more and more abundant these days because of the lack of staffing. So it is, to say the least, a frozen position certainly affects us tremendously. We have a lot of different community engagement projects that we want to move forward on, and we can't. We simply can't. So it's gotten to the point where, because of a lack of staffing, we have to kind of pull everyone together and decide, what is our priority? And our number one priority is to answer calls. And our number one priority is to make sure that, emergency situations are covered at all times. So we are going to shift some of our positions, from our detective bureau, some of our community policing areas to be able to make sure that that coverage is there. So it does affect our department. And certainly we want to help the town out. We understand that the budget crisis isn't just within the police departments, across the board. And we want to be able to contribute, but it certainly does affect us. So I thank you for that.
Thank you. I know, Mandy, you had a question that I think you received it, but we're a town that also has this large university which has a police force. To what extent is that an asset for you? Is there any ability to say, there are, or are they pretty much like the Vatican in Rome, where they stop at the border? So just, is there any ability to coordinate or augment work, particularly related to off-campus students?
So I think that's a misconception that a lot of folks believe that because the university has their own police department that they can be shared. Unfortunately, that has been tried. I'm going back probably about 10 years ago when we attempted to have co-response with the University Police Department to deal with a lot of the issues from off campus. But of course, there's union implications. And from that point on, we also learned that they not only have a different philosophy and they have a different set of policies and procedures. We learned from the university that the university doesn't want to, they're paying their officers to stay on campus and to patrol their jurisdictions. They don't want to patrol the town of Amherst. So therefore, when the issues are off campus, it solely falls on our hands and not the universities. We do have a mutual aid agreement, but those are for usually for pre-planned events such as Blarney and emergency situations. That's not sustainable for something that's on an everyday basis. Again, they have their jurisdiction to patrol, and we certainly have ours. I wish we had a larger number. They have about 65 officers to their police force, so we would love to bump ours up. Hopefully that answers that, Kathy.
Yeah. So I don't want to dominate this, both Andy and Mandy, but Andy, you had a set of questions on this. So do you want to jump in with the next set?
I think Andy should first.
Yeah, Andy?
Yes, I think that you've responded to the first question, which was how will the freezing of positions affect department's ability to provide essential services? And but there was a little bit on covering shifts, and if you could say a little bit more about that, and then bridge into the second question about uh, what's the budget available for overtime, and how is that utilized to address those kinds of issues?
So our department's been level funded for the past 20 years, so the overtime budget has remained the same. Fortunately, we are able to forecast to a degree how to utilize that overtime. However, it's being expended a lot more quicker these days because of staffing level issues, things that I discussed earlier in terms of departures. Whenever we have large amount of departures in the past month or so, we have lost 5 officers. So that's 5 officers that we have to replace, and it takes time for us to do that. We have a minimum mandatory coverage, which means on every shift, we have a minimum of 3 officers on the road, including 1 shift supervisor and 1 officer in the station. So we have to have that coverage. That's essential. So if we don't have enough officers, then we force them to work those shifts via overtime. So it has affected our overtime budget in terms of the lack of staffing, and we try to make it work the best that we possibly can. I would ask Captain Young or Captain Menard to chime in if there's anything additional there.
I think I just say that, it's not sustainable. We do the best we can with the numbers, and, officer safety is also so important out there along with the community members. So, we're going to have to look at really reorganizing a little bit and really focusing on some priorities.
So if I may just say one more thing, Andy, one thing that's been, these issues have been affecting us when it comes to certainly retention of officers and certainly with recruitment. These days, future officers are looking at departments intensely. They're not just grabbing whatever they can. They're taking a look to see, which community fits them better. And, if you go to some of our neighboring departments, they don't have these forced overtime issues. They don't have to work the weekends as much as ours do because we do work for a college town. There's generational issues too. They're just different. They don't want to work weekends and they don't want to work nights. So they're gonna move on to other departments that are gonna fit their needs a little bit better.
Okay, I don't have any follow-up questions along these lines. Do you want me to just continue with my list?
Yeah, I would just continue because we have.
Because the next question gets into when I said I would ask this of all these initial questions of all of the departments, and that is, I'm going to ask each of the 3 major departments that are in public safety about the assessment of the integration of police, fire, EMS, and CRES to provide a full range of public service needed in an efficient and effective manner. So if you have any thoughts on that, would appreciate hearing.
Do you want to start with me or some?
Yes. Yeah, no, we're trying to focus on each department separately.
I see. So I think the Amherst Police Department is willing to work with any entity that is able to assist with public safety and solve problems. We've traditionally had an extremely very good relationship with the fire department, and since the inception of CRES, we've had a very solid relationship with them as well. I think it's been very much a work in progress in determining what type of response that CRES goes to and what type of calls. I think that has not truly been solidified yet. But when it comes to working together, I think all 3 departments work very well together. We communicate effectively, and we constantly discuss issues that arise and how we can make things better. So when it comes to relationships, it has been very good.
Can I just follow up a little bit, Andy, on it? Because you other part of your question is, at least conceptually, when CRESS was formed, we had a concept of nonviolent as a particular focus for the non-uniformed. And so looking at the calls that you have listed on 120, on page 125, I'm not sure how one can categorize them, but which, if any of them, could be handled by a team that included CRESS. And then secondly, you have co-response with CSO, which I believe is mental health social work. So, one of the questions I have is if you were more tightly coordinated with CRESS, for example, co-responding on some of these calls with one of each rather than four, could it be more integrated? And I realize we've had a non-co-response model, so I am aware of that, but I'm just saying hypothetically.
I think those are some of the major challenges. I do recognize, and we're very sensitive to the fact that we understand that when CRESS was developed, it was to be a separate agency and not to be a co-response. So we wanted to make sure that we honored that, because we want whatever benefits the town the best. That's something that we are going to certainly focus on. And at the time, that was the charge, was that CRESS was going to be a separate entity. So again, we are very sensitive to that. But that doesn't mean that we're not willing to engage and help and collaborate together. And certainly, one of those issues, and I've always tried to simplify, I guess, the concept of responding to calls. Really, it's two-pronged. The two things that we focus on is safety and liability. And the first step is safety, so once the safety issue is mitigated, then it goes into handling the call to make sure that the liability piece is covered. So therefore, when we have a co-response with our clinicians, for example, we go along with officers. And when the officers mitigate that safety piece, then the co-responders, as well as the police, can now enter into responding to the call itself and trying to problem solve that, to try and eliminate not only the liability, but figuring out what's the best plan to solve the issue. That's something that we haven't really had with CRESS because of that separation. But I certainly think that if we did, it would work very similarly in that fashion. I know that there's some questions along the lines when it comes to our partnership with CSO and our clinicians. And when it comes to that, I would like Captain Young to speak upon that. He's been instrumental in having the responders, the clinicians in-house, and he knows all the ins and outs about that. So to answer your question, I think it will work very well.
So, we would welcome hearing from you, Captain Young, on how that works with CSO.
Certainly. Can everyone hear me? I think I am muted. Yes.
Yeah, you're on. We can hear you.
One of the baby boomers in the room. Sorry. So so co-response is not our idea. I'd love to take credit for it, but of course it's not. Co-response, most of the larger police departments in New England are employing co-response and have been for many years. We started the journey here in the police department back. Actually, this goes as far back as 2014 when we started with CIT training. And we started training specific line officers and all of our supervisors on a better model, for responding to people with developmental issues, with people with mental health disorders, substance abuse disorders, things of that nature. At its core, the original program was a jail diversion program, right? That was the whole concept. Was we would respond to an underlying call, and it's one of the things when you look at the data on that particular that's in the budget book, some of it just because of the way our records management system operates, sometimes the underlying causes are hidden. So it may come across as something like a disorderly conduct response or a noise complaint or, shoplifting call. But in reality, it might be somebody with some other underlying issue. In the olden days, when I was a young police officer, we'd go, we respond to the call, solve the problem. Perhaps we'd make an arrest, perhaps we wouldn't. The goal behind this program is that we avoid that. It is at its core a jail diversion project. It is designed so that we facilitate people who need more services than we're able to provide, to get that to them in real time, whether it's at the ED, whether it's at the VA, whether it's seeing a primary. About 2018, 2019, and the pandemic kind of shortchanged this here in the Commonwealth a little bit. A lot of the agencies, us included, we started exploring the options of going to a co-response. So in other words, as the chief pointed out, we would go to a call, one of these calls for service that may come across as a disturbance, it may come across as an assault. And we got there and were able, through the training, to identify that this was something more than just that arrest was probably not what was best for the community. And having a co-responder here in the building allows us to get clinical support in real time. It's really nothing more than that. CSO has been in our community for many years. They're here every day. They were here today, and we weren't aware of it. They went and assisted a client in some way, shape, or fashion. This just really, from a fundamental standpoint, just speeds the process along. We don't have a clinician here 24/7, but we do have one here. In the morning hours, usually to the evening hours, at least 4 or 5 days a week, 5 or 6 days a week. The clinician can do certain things. We've established a protocol for a warm handoff. So many instances, the uniformed police officer will respond there. And then we ultimately try to hand that off to the person. We try to disengage having the uniformed officer there. If the clinician feels safe, we have a criterion that we've developed. And then we try to, create a supportive, backdrop, aftercare, things of that nature that we've discussed in the past. So that's really the program at a very banal sense. There are a lot more of the tentacles that go out there, but that's why the CSO clinician is here. If I haven't said this, I apologize. We don't pay for CSO. The town does not pay for CSO. Some of it, our training is grant funded. The Department of Mental Health provides the training. I'm hoping, that this fiscal year that we receive another award. So we have many new officers that need to receive the training. And CSO and DMH have worked out the funding for the for the clinicians that are here. So it is, other than a little bit of electricity that they use while they're in the building, it is at no cost to the town.
Okay, I see Tom has his hand up. Just a quick follow-up. Do you have one or do you have more than one person?
There are actually two clinicians. So one works here primarily during the daytime. She's our established clinician. She's been here for several years. And she does a lot of the outreach. Some of you may have come across. She actually does a lot of outreach with CRESS. She's at the various different places in town. She sometimes goes up to the survival center and things of that nature. And then we also have one here that's in the evening. She's here less frequently than our daytime clinician, but we found, and more importantly, CSO identified that a lot of the calls that might have had a greater aptitude for either arrest or ending somebody in the ED, that some immediate clinical response would be helpful, and it has proven to be that. I hate to provide stats. If you want them, I have them. I will say this, that, traditionally I looked at the last 3 or 4 years, our response to, a uniformed police officer response to somebody who specifically to a mental health disorder is about somewhere between 500 and 550 calls per year. Those aren't the ones that are masked as other calls. Those are the ones that are specifically identified as that. I keep very close data because the Department of Mental Health requires it, on the number of those calls that result in an arrest. So a great example is over the last 30 days, the last 90 days, Q3 of this current fiscal year, we responded to about 66 calls, and one of those resulted in criminal charges, and it was a non-custodial criminal charge. The other 60 of them were diverted. 65 of them were diverted, which means a variety of different things. It was either, solved at the scene, the person was transported to a medical facility, they received clinical, response at a respite, et cetera, et cetera, et cetera. So that's kind of the goal. And that data that I keep is pretty much on point over the last several years. And even going prior to the pandemic, really, it's pretty solid. But post-pandemic, the numbers have been spot on every quarter. They look very, very similar. And again, I don't want to bore folks with data and stats, but
Yeah, enthusiasm never bores us. Thank you.
it's
Um,
it's it's
I
an
think-
important it's a very important function of our agency. It's a paradigm change for certain, but it's in better support of the department and as well by and far for the community. It just supports the community so much better. There are people that we were arresting in the past that we should not have been arresting. It's a fact.
I see Tom's hand is up and Andy's hand in that order.
Thank you, Kathy. Thank you, Chief Ting and Officer Young. This is really appreciate the detail on the methods and I can understand how it's a difficult situation in the occasions that arise where you've got to make assessment or discernment decisions quickly or in coordination. I know that there's been a lot of community dialogue on this that is delicate and potentially very synergistic relationship between the police and Crest. So I guess what I want to ask is not purely a financial issue per se, but and maybe the clinician that you just were describing is part of this. But my question is, how does this discernment or signing work? I presume at the dispatch level. Is that where the branching takes place? And if there were to be a move toward a different kind of, maybe more closely, you called it a co-respondent model, would the cost of that kind of change be more in terms of personnel? Would it be more in technology or tools? I'm wondering how the discernment happens if it is indeed at dispatch, and what would be the costs if you were considering changing that.
Is your implication, sir, for co-response with Crest and a clinician at the same time? Is that what we're discussing?
Yes, if I understood Chief Ting as he was describing the model, not that we have, but that has maybe been proposed or discussed in the past of a ride along between people of both units.
Yeah, I certainly don't want to speak for the chief. That's kind of a new question that we would really have to think about, because there are maybe some underlying costs. Certainly training would be an issue. Policy discernment would be a very big issue, right? Like, so our policies would have to be either written or changed so they'd be in coordination. Again, I certainly don't want to speak for the chief, but I think I can in this area. We want to do what's best for the community. So, and if partnerships, partnerships with both the fire department and Crest are part of what we do. And if ultimately that's what we do, then that's what we do. But there would be some bumps in the road. We'd have to overcome them. I mean, policies would be the first thing that pop into my mind. Chief, I don't want to speak any more out of turn here. So
in total agreement, there's certainly, if that's a marriage that was to be brought together, I think it would be very fruitful. But it'd be a small transition. I don't think it's something that would be fatal in terms of training people and adjusting our policies. I certainly think that that's extremely doable. And I don't think the cost would be astronomical. Jay, Jason Rushford might want to chime in, because certainly that would affect your processes.
Yeah, thanks, Chief. Thanks, Tom, for the question. Yeah, so when dispatchers get a call for a mental health criteria type call, we screen the call for violence, for immediate threats, injuries, etc., based on our training experience. When we dispatch right now, the police department to that call, CSO is monitoring our channel. They hear the incident They decide whether it's in their realm of responsibilities and what they can handle per their policies, and they respond as well. They will radio to us and say, we're also responding to that call with the police department. With some of the more non-emergent incidents where we have the time to do some research on the person that we're dealing with or the incident that we're dealing with, we may call CSO who's on duty by phone and say, this is what we have going on. I wanted to give you some background. And then we dispatch police and they decide to jump on board and go per their policy. So right now we are just sending the police officers. CSO hears the call and they decide whether or not they go to that call with the responders that are currently going.
Thank you. It's very illuminating and I appreciate the details.
Of course.
So, Andy. And
Yeah, I'm just gonna limit it to one more of my questions and then give Mandy an opportunity to say something. But as you're talking about the mental health issues, and this goes to, both dispatch and to police department, are there legal by state law or other restrictions, things that only police officers can have the discretion to do as far as an intervention strategy?
Yeah, very intuitive. It's one of the parts of the law that truly, from a legislative standpoint, it needs to be revisited. It's very antiquated. It has been for many years. The law reads the same as it went when I went to the police academy, which was back many centuries ago. Right now, currently specifically, Mr. Steinberg, as we talk about like involuntary commitment. So we're talking about something that is really at the most volatile state, which of course creates the most danger for folks as well. There are very specific people that are able to, for lack of a better word, create some type of impasse to force somebody to end up into a medical facility, which is where they belong. We all agree that they shouldn't be arrested. They should be brought to an appropriate place. So when we talk about involuntary commitments that are outlined under Chapter 119 of the General Law, it's a physician, it's certain clinical workers, and it's police officers. And I understand why the law was written that way many years ago, right? The cops are always out there. There's always a cop out on patrol. And in an emergency situation, a police officer could respond. And if they had to get somebody to the ED, they could. We're not going to solve that problem here in this, although this I think is a great working group. I don't think we're going to solve that problem here. But unfortunately, it's how the statute is written. It's how it's interpreted. There's a lot of case law on it that supports that. And as a result, we're kind of stuck with that. So, for instance, I'm looking at my brothers here from the fire department. Their clinical knowledge is far surpassing what I will ever have. But a firefighter is not, a paramedic is not permitted to involuntarily send somebody off so the police have to be an integral part of the response. It's kind of a very odd catch-22. It's just the way the law is written.
Just a quick follow-up is, do you have any statistics or any concept of the number of times that might arise in the course of time?
I do. If by the end of the presentation I could get you specifics, but just off the top of my head, I'm looking at like the 66 calls that were we had co-response last time. I'm going to say about 15 to 20% of the time. So like last month, I'm just looking here very quickly at my graph. There were 9 involuntary commitments. So 9 out of the 66 calls for co-response. Sometimes that number, it fluctuates, right? So, acuity changes depending on the time of year. It depends on a variety of different things. The time of year actually is very, very, our models change based on the time of year. But so it's one of the issues we have, as the chief alluded to, as it relates to co-response. Safety, of course, is a concern, right? So, if we were to respond with Crest, we would just have to figure that portion of it out, in terms of how we had a warm handoff and what that would look like, and some other training issues that we would have about, identifying certain parts of criminal activity and so forth. Certainly something that could be overcome.
Mandy.
Thank you. This might need to be answered by a lot of different department heads here, maybe all 4. as I get into this, but I want to in some sense circle back to the question that was asked about on the service level page, which is 125, which ones are most likely able to be responded to by CRES or as an individually response, non-co-response, or as a co-response, similar to what CSO is co-responding to at this point. Similarly, medical assists, are those types of calls? It was a great response regarding why maybe mental assist might eventually need a police officer to show up, but are those types of calls that need police first versus CRES versus just EMTs and our paramedics, and then to the dispatcher, you talked about how CSO listens to the dispatch calls and determines which ones they might respond to based on what they're hearing on the dispatch or whatever it is. I'm not sure I'm summarizing this correctly, but are CRES doing the same thing? Are we literally having a CSO responder, a CRES responder, and a police officer respond to some of these? Because that doesn't seem very efficient to me, and it seems like there's a lot of overlap between the CSO co-response model with the CRES model, such that are we actually efficiently providing services as intended when we created CRES? And to go along with that, is there an opportunity for our CRES to follow the CSO model without necessarily being co-response, or to bolster the CSO model such that the CRES the CRES responders might be there at different times than the CSO responders, or the CSO responders there at different times than the CRES responders, so that we don't have a lot of duplication going on. I guess I'm just trying to, it's a long-winded sort of multi-pronged question that says, are we duplicating efforts, and have we over the last 2.5 years through dispatch, through our policies and procedures, actually given CRES a true opportunity to be taking up some of the service level calls that are listed on page 125 for police? And if so, or if not, why or why not?
And I just want to underscore what Mandy said at the beginning. Camille, you can join into this conversation. We don't have to do it as first one month, then another. We're a group at this point.
If I can just say a piece relative from the police aspect, Captain Young did a wonderful job in kind of illustrating the need for the police. Just to answer your question, Mandy Jo, when it comes to a mental type of call, usually the police almost 100% have to be there, at the very least, to ascertain what the problem is, because it's the unknown. Any call that goes out there, the only thing that we as police officers can predict is that it's going to be unpredictable. So the police have to go there and assess the situation and make a determination if safety is an issue, or if there's other factors that are involved. Certainly the standard for an involuntary commitment is if a person is either a harm to themselves, a harm to others, or placing other people in danger. Sometimes that crosses the line of criminal activity, but of course, as illustrated from Captain Young, that's not the goal. The goal isn't to arrest. The goal is to get them some type of help. So that's when we talk about the safety aspect, and the fact that police officers are the only ones that have the ability, other than physicians and some clinical workers, to be able to administer an involuntary committal. That's the reason why we have to be there.
Can I just ask a follow-up to what you just said? To what extent, we're focused on the bigger numbers on your list. Do you have in the hospital world, they have a term called frequent flyers, which are people who are just repeatedly in the emergency room, but they're known. You know, when the person comes in,
Sure.
they're known that, you know, sometimes it is, you know, unstable heart condition, but sometimes it is homeless and drug. To what extent, you know, is it 50% of the time the person is known to you, 80%, 10%, you know, in terms of trying to figure out what's going on? Are there is what I'm asking clear, you know, that or it's only 10%, you know, in any given day, 90% of these calls are people that you were unaware of before.
I'm happy to answer that, Chief. So
Go ahead.
we use the term high frequency users.
Okay.
So and we of course do have folks like that in town, right? That people quite frequently people will call, and as we talked about, you know, some of the data that's that's in the budget book can be a little. Lots of times we respond to the call originally, and it comes in as something other than a call for a medical mental call. It comes in as a trespassing, and we get there, and it's a person who might be identified as a high frequency user. But and I couldn't give you a percentage.
Okay, no, that's okay. Yeah.
But I could get, you know, I could try and work at that data if it was necessary for, you know, another meeting at another time. But I will say that we receive a lot of calls, and I'm not talking about weekly, daily calls where we check on the well-being of people whom we've never dealt with before. We have one interaction with, and then we never interact with them again. And I know that just because we have to report that data to the Department of Mental Health. It's something. It's one of within when you look at the way they collect the data. There's actually thresholds that are there, and it can be sometimes hard to mine out of our you know our records management system's a little dated. So, but it's available, and we could provide that. It used to be much. It used to be that. It's a great question simply because years ago when I had all my hair, the high frequency users were a much higher number, and that is it's actually flipped the other way. We still have those folks, and we try to advocate for them the best that we're able. But we actually, you know, we encounter new folks all of the time. Some of them, and a lot of them, very young people, which is again a bit of a shift from past data.
Thank you. I see Alicia's got her hand up. Alicia?
Thank you, Kathy. I have just a couple of clarifying questions. I just wanted to confirm earlier, I think you said that the CSO responders, that they are funded by a grant. Is that
No,
correct?
no, they're not funded by a grant. So our training is funded by grants. So the police
Okay.
department, our training is funded by a grant that's awarded by DMH. It's a renewable grant that, matter of fact, it's up for renewal on July 1st. CSO and DMH have coordinated payment through different sources. Some of it has to do with insurance monies and so forth, which I don't want to get into. That's CSO's business, but we do not pay that through the grant. Payment does not come from the town coffers either. That is something between the Department of Mental Health and CSO.
But
Okay. Sorry,
correct,
go
you
ahead,
don't
Kathy.
you don't have to pay the clinicians though.
That is correct.
Okay.
That is correct.
Alicia, I'm sorry to interrupt you.
No, it's okay. I'm just trying to just fully understand the picture of the CSO co-responders. So they have never been paid for by town finances,
Never.
their services.
Never.
Okay. And the agreement that we have with CSO is a long-term agreement, or does it have an expiration date? How does that work?
Yeah, so we have a memorandum of understanding with CSO that we renew biannually. It's reviewed and renewed.
Okay. And when did we start doing this?
So we first started CIT response in 2014. The first preliminary, let me see, the first preliminary co-response model came out in like 18 or 19. It was just before the pandemic. And then we actually had a co-responder in the building in either 20 or 21 because it was right in the early stages of the pandemic. Yeah, it sounds about right. My dates might be off a little bit, but it kind of got derailed a little bit when the pandemic hit. So.
Okay, thank you. That is just helpful for me because I'm trying to follow, it's helpful for me for your feedback and then more directed towards the other finance committee members. I'm trying to follow this trajectory of the conversation that seems to be a very large implication of people wanting to find out information about what a co-response would look like. And I'm trying to understand where that is coming from since there was never a recommendation to make this a co-response with the police. And so I'm assuming that it would be for budget reasons, right? Like financial reasons. But the CSO person doesn't come out of our funding. So that's not really that's not a town funded position.
No, it's not. And if, and again, what you're talking about, that's a different political discussion that I'm not about. Just the one thing I want to make very clear is the CSO clinician is here for the community. They don't work for the police department, and they have worked with other members of public safety and will continue to do that. And we encourage that. Yeah, it's not the police department's clinician. The reason that they get embedded with the police department is just simply because we go to the vast majority of these calls, and we can also help provide a safe environment for them. Again, thinking about what a warm handoff is. But if Camille called and said, "Hey, can Louise come over here because we need help?" and I know Louise has been over to Crescent, intersected with them, and worked with them, we encourage that. Again, it's a community resource. It's not a police department resource.
Okay, thank you. That's really helpful. Um, and so it seems like to me, while the CSO position seems like it's important, and it seems like it's been helpful in terms of like managing those kinds of cases and in terms of like what happens after the interaction. So I think that that's great, but it just, again, directed at other finance committee members, it doesn't seem to me that those services are what Cress is doing or what Cress is supposed to do. And so I don't think that those two positions are equally interchangeable. Cress is an entire department, and the co-responder people are in their own position in their own department there that has nothing to do with the town. Um, so I guess I'm just also just not really understanding what all of those questions were about. And I wish there could be a little bit more transparency in terms of what people are actually asking for and why these questions are being asked when we're wondering about the police budget.
So Alicia, at least I can respond just on way back when we looked at the list of what the police were doing in terms of the calls we're talking about now that are listed there in 768, 454, they were flagged as potential calls that could be diverted to Cress. You know, that if Cress was on, there would be less police activity. And so part of this is, are there a variety of reasons they've stayed with the police rather than shifted to Cress? And I see Camille, you make sure you weigh in. And so it is a question, I think you use efficiency. It's if there is a smaller Cress department and we can get to the implementation manager as a separate issue, would the police just said they may have to be reorganizing with less staff, try to think about what they're doing with their staff. Do we need to think about that across departments, not just in police, but in Cress and potentially fire? If fire EMT could handle some of these, but the law prohibits them from doing it, even though they've got the expertise. So it is trying to think of, with scarce resources, can we do as much, if not more? At least I think that's where the questions were coming from in terms of flagging these, because these were literally yellow highlighted in my old budget book on the potential areas that we would see Cress lowering the need for a uniformed police force response. Mandy, does that, and Andy, I mean, it's just, it's not like, and clearly it's not every single one of those calls. There was a thought of, do they get handed off over time? Does the person, when I asked about frequent, if you get to the point you know the people and you can develop a longer term relationship with them, then the preventive side of it comes into being, that they don't go into crisis. So that at least where mine was knowing the people. If you know, if they're known over time, then you can more easily create fallbacks where they know who to call when things are getting out of fine. Camille, go ahead. Yeah.
Okay, I'm just gonna do just a second here when you said about, so the whole point of CRESS is about diversion. So when you were talking about the amount of calls that are coming through dispatch, the majority of our calls are coming directly from our neighbors. So we have what we call the known neighbors, which are the people that would have been called the frequent flyers or such. And or else businesses, the library, other town departments that are calling us rather than call police for these neighbors. So a good portion of the people that we deal with are people that would otherwise have been dealt with police interaction.
Thank you. So Mandy's hand is up, and I see Jason's hand is up, and Alicia, I don't know whether your hand is still up or you put it up again.
Yeah, my hand is still up, but if Mandy wants to go first, that's okay.
Yeah, I just wanted to address Alicia quickly because I'm mindful of time, but also request that my prior question maybe be answered. And Camille, you did touch on what my prior question was a little bit, and I'll have follow-ups when if we're formally moving to CRESS at some point. But yeah, in a time of financial stress, I think it's important for us to explore ways to more efficiently and provide services that might save money, and that might require, and I'm just going to say it, it might require consideration of a different model for the provision of the same services that CRESS are providing right now, because it might be cheaper to provide it in a different model. And that's not to say I understand that CSWG did not recommend that, but recommendations are recommendations. We need to look at what's on the ground. And it's not a conversation necessarily for today because we're here to hear from everyone else. But that's the basis for some of my questions, is getting an understanding of what we're doing, what's capable of being done, what can or cannot be transferred, and are there more efficient ways to do that that might allow our personnel dollars to go farther in terms of the provision of services.
So, Alicia, I see Jason at dispatch also has his hand up, but you can certainly speak, Alicia, and then Jason.
Yeah, if that's okay, I have a quick follow-up, and then my second question is actually also for Jason. And then I hopefully will be done for now. But okay, thank you. That is helpful information. And I do understand that recommendations are recommendations, but the CSWG, what they did was look at what was happening on the ground. Like, we weren't purely looking at this in terms of budgetary reasons, which I understand is the role of the finance committee. So it makes sense that we're having this discussion, but I think the discussion of dollars ignores the discussion of real life experiences in this town, and it assigns value to those experiences. And we are completely neglecting and ignoring an entire portion of our town who has different needs and different experiences in the name of budget. And I am uncomfortable with that, especially because we haven't had the chance to review CRESS. And so, like, I would hope, again, that this question could be, that this conversation could be a little bit more focused on looking at what is happening. And some of the questions I felt like should have been directed at CRESS rather than the police. I would have liked to have, I know it's hard because there is a lot of overlap when there are different community safety departments and they all work together. But I wish there would have been a little bit more separation here, because it seems like we've been talking about CRESS so much of the police presentation of the budget. My other question, though, because dispatch is here, is CRESS able to take calls from dispatch right now? Like, are they able to be dispatched calls?
At this time, no, we are not dispatching CREST to any calls for service.
Okay, thank you. And so that would really make sense to me why we're not seeing a reduction in those numbers, because we're not even sending any of the calls. And so to me, that is not an indicator of efficiency, because we have not even tried it yet. And again, this is like my own personal issue with freezing the CREST positions is we haven't even given them the opportunity to try to do what they are supposed to do. So how can we talk about efficacy? And how can we really evaluate its financial status here? I think it doesn't really make sense, but I'm happy to sort of leave that question off until we get to CREST.
Amanda, your hand is up, and I am conscious we also have fire here. So, you know, the logical segue would be to do Crest next and then go to fire if that works for people. But
that does, and that makes sense to me. I just have one follow-up with dispatch then. It was my understanding that dispatch about a year ago started dispatching to Crest. So this is kind of a surprising answer. And including that service levels indicate Crest Assist AFD, Crest Assist APD, Crest Transport, Crest Follow-up. It's got, oh wait, that's the wrong page. Give me a second. The service levels have CAD calls initiated, CREST CAD documentation, CREST calls dispatched, CSO CADs. So can you answer why you're not dispatching to CREST yet when it had, I thought, been reported that you were dispatching to
Right.
CREST? And then on those service levels, what are they then?
Sure. About a year ago, I was not in this position. I took it over after my curtain left in June of last year. The anticipation was we would be sending crests to calls that they were allowed to go to. The hang up for not sending them to calls is we do not have a single policy approved at the town level that releases us of liability if we send them to an incident. Every time we answer that phone, we inherently have a level of liability on our shoulders, and we need to pass that off to the appropriate agency. Police, fire, and CSO, when they self-initiate their calls to go to that we have responses for, have those established policies. We know who to send. We know how to handle that call. We still do not have any policies written that are approved at the town level that we can assert that we can send these calls to the CREST department. Once we have that, absolutely, we will send the calls to them when we know what they can handle, what we're allowed to give them. At this time, we do not have that. And I'm happy to explain the CAD documentations if you'd like me to move into that, unless you have a follow-up.
If you can do it in like 30 seconds.
I can, absolutely. The CREST CAD documentation, that 502 number, at this time, like Camille said, they have a lot of phone calls and walk-ins where they handle things with their neighbors and they help residents out. They contact us and say, we need a CAD for an assist citizen or assist neighbor CAD. Can you document this for us? That's what those are capturing. They're capturing their activity that they're self-initiating. CREST calls dispatch, that's coming from dispatch to them. Now, I said I don't dispatch calls to them, but when the fire department is on scene of, say, a structure fire, and they have a family that needs some resources, they call us and say, can you send CREST to us? That covers that. That covers some of the transports that have been requested by police or by fire. So those are the dispatch calls that we send to CREST at this time upon request by another agency. And the CSO CADs, when they respond to an incident with the police department, they get their own documentation because they're not a town employee, and they go on their own. We just need to keep track of them for safety reasons so we know where they are and get to capture their documentation of what they're doing.
And I know you're trying to stay under the 30-second rule, and I promise this will be less than 10. One of the other issues too is because of their clinical status, there's certain privacy exemptions. There's certain things that we're not able to and are certainly not public records, so they can document it within there, and we can protect things that that they learn in a clinical setting. We try to be very, very, very mindful about people's people's privacy. There are some very real penalties for violating those rules, and so that's another reason for a separate documentation for CSO response.
Thank you. Alicia?
Thank you. Yeah, I sat on the first CREST implementation team, and we did a great deal of discussion about the liability that is with dispatch in terms of deciding which calls go to CREST. And so I respect that it's a very, very complicated issue. But I sat on that committee nearly 4 years ago when we were having that discussion. And so I guess my question is, how long does it take to come up with those kinds of dispatch protocols, and what has been the holdup? And are there any actual budget implications to implementing such protocols?
If that was directed to me, I can establish that. The protocols are not coming from dispatch. The protocols would be coming from the CREST department saying what calls they go to, how they handle them, and what they can handle. Once we get those and they're approved, then my people will know what to send to them. But we are not establishing those protocols. Our protocols would be based upon what protocols we get from CREST. This is what they can handle, and this is how my people are going to handle it.
Okay, thank you. That is helpful. So have you not received anything from Crest that says which calls they would be going to? Because I just feel like we've been having all of these discussions, and so maybe there's some general confusion about what the process is supposed to be.
Correct. I don't have any policies right now. I am under the understanding, I know that they are being worked on. I've assisted with some of those, but there's nothing in our hands right now that establishes what they can go to for calls and anything that's approved.
Okay, thank you.
Maybe that's a good transition to Camille, who has been incredibly patient.
So one of the things about these policies is that a year ago, we had developed some policies for CREST to go to dispatch, and they had to go through APD first. And then it was determined that the policies that we had were not in depth enough and were not going to be covered. So the implementation manager, Kat Newman, was working with Captain Young, Ron Young, on these policies. So the macro level policies are completed and they were just being revised. But then also the other part of this is that after these policies are done, they still have to also go through legal. So this has been a very long process to make sure that everyone is covered. We have worked diligently with both Jason in dispatch and Captain Young in APD to get these done. And with everything else that is on everyone's plate and other things that are coming up, finding time to dedicate to getting these policies done has taken longer than expected.
So we have, I think there were some specific questions both on Andy's list and Mandy's list of CREST. Unless we've covered them. Andy?
Yeah, I think that one was, and this was actually also a little bit in Mandy's list, so I don't know if she wants to take it up, which is a question of whether the mission of the department has evolved since its inception, and if so, what has been the process that led to any change in mission. Mandy, did that capture some of what you were thinking too in one of your questions?
Yeah, I mean, and I'll use some quotes from documents to sort of expound on this question about has the mission evolved, because the CREST mission described on page 130 of the budget book starts with, quote, to fill service gaps in the town and to connect people to services and resources. That's what it starts with. The November 12th, 2021 memo from the town manager seeking establishment of CREST states, quote, the reason for creating this agency is to provide community safety services in situations that don't involve violence or serious crime. It will create a civilian unarmed alternative to calls that might otherwise require a response from the police department. You know, he went on in that memo and presentation to say providing community safety services in situations. The goal was to create the department as a civilian unarmed alternative to the police department. So that gives some statements that to me don't quite seem to match each other to potentially point to a mission change. So yeah.
So on that, one of the things that I read that and had to think about it is that nothing has changed with the mission, but what's happening is it's complex and there are layers to what CREST does. One of the things that people are missing here is that, for one thing, we have been able to give Salvation Army vouchers. So what Salvation Army vouchers do is that they're preventing theft. So at stores, so like people who need essential food items, blankets, clothing, etc. So these are the same people that now are no longer getting calls for shoplifting or stealing or breaking into places. Also, places like Craig's Doors, where if somebody's having a difficulty and is need to be quote unquote moved along, Crest is called to come in, have a conversation, and see what their needs are. And this also means that police are not needed to be called. Or we have the neighbors who call instead of calling police. So all of this is diversion, which is in the main CSWG report. And it's also part of our equitable approaches to public safety, the EAPS grant that we received. And another part of the EAPS grant was it was to serve for a BIPOC community and also to do some youth engagement. So there was a lot of levels to the grant that we are fulfilling, but there's a lot of work that we're doing in the community with the elders. And since the senior center did not have a driver, there were some people that were unable to get their doctor's appointments, etc. So we were filling that gap. Okay. Someone who threw away their medication accidentally and needed their heart medication and couldn't get to it. So these are the type of things that we've been doing. And the other part of it is that we deal with these calls deeply. They're deeply rooted issues, and a lot of times they need in-depth time. So those are the type of things that we have been doing. So the mission has been mismatched from the community, what the community demanded, what the EAPS grant was funded, and what was advised by legal counsel. And I wasn't here during this part, but I found that that the legal did not come until the leadership team was established, and that was in August of last year. And that's when they did the review. So our primary purpose is to reduce the number of police department interactions and provide for all members of the community. That hasn't changed.
Thank you. Anyone else? We've heard, actually, we heard in public comments the other evening also, the implementation, the slot called implementation director, or that's Kat's job, that's been grant funded, is that correct?
Yes, it is.
And does that grant, is there an expectation that we will get another grant to support that position?
With the current political climate, we're actively seeking grants, but that grant right now, as it stands, is not going to be renewed.
And so the funding for that position is disappearing, is what you're saying?
Yes.
Yeah.
Yes.
Okay. So that in effect is 2 vacancies and one additional person.
Yes.
Okay.
So we were losing 1/3 of our staff.
Alicia and Mandy both have their hands up.
I was just gonna ask for Camille to describe the effect that the staff FTE freezes will have.
Oh, so we are losing 25% of our responders. So that is going to definitely affect service levels because we respond in teams of 2 for safety and training. And that is now that we'll only have, right now we have 5 with the being able to hire 1, is still not going to allow us to expand hours due to people being off, vacations, and they respond in teams of 2.
Alicia.
Thank you. I have a couple of questions. The first one, I'm wondering if you can just also talk about really quickly the impact of losing the implementation manager, because I know the department doesn't have an assistant director. And so I'm wondering what that impact is.
That will mean it will be myself as the director. We have a administrative assistant, and then currently 5 responders. So I have no second in command. And if I'm out or on vacation, there is no one else there. And Kat came in. Kat is the longest Crest employee that is now. Kat also did all of set up the training, and Kat, as the implementation manager, is also working on grants. She also is working in for the EAPS grant. She was the EAPS grant contact person, and also she has been the one working with dispatch and Captain Young on our SOPs and setup for dispatch.
Okay, thank you. I have two other questions. I wanted to just circle back to dispatch question again, and the protocols. So you said that the protocols have to be approved by legal, and it's a long process. So have protocols been given to the town?
They're still in the process. We finished part of them. So originally what happened was that we worked to try and get the protocols done before the Government Performance Lab, the GPL. Our contract was over. I came in April of last year and started working with the GPL, and that was only from April until I think it was June 30th, and that was their contract. So with them, we developed some protocols. However, those protocols were not adequate for legal protection, and that's when we realized that they needed to be gone through step by step. And that's where APD and Captain Young, and then Jason, when Jason was made the supervisor, that's when we all started working together in the
Okay,
fall of
and
last year.
thank you, sorry. So you said that who were they deemed not sufficient by? Like you
Police
just looked at
department
them?
and the APD, and also because of the legality of it.
So did it make it to the town's legal department for
No.
review?
No.
Okay, so for the next set of protocols, do they then also have to be reviewed by the police and others before they make it to legal?
Yes. We're working collaboratively on them.
Okay.
So I would say one thing. So one of the things that we're working on, and so police and fire have had these protocols and standard operating procedures for a millennia. So as a new department, Crest has had to create new protocols, but at the same time, so that we are all on the same page, the protocols that we have to match what police and fire use, so that we're all speaking the same language.
Okay, that's helpful. And then I just have one other question, and my question's what I'm really leaning into here is like the efficacy and usage of CRESS. And so I know that like some of the reason why it hasn't been used the way that it is intended was because we don't have that dispatch section set up. And I think that CRESS was created to be a diversion, but I think the second piece of that idea was that there are also community members who are falling through the cracks because they don't utilize typical community safety resources, and that they would prefer to have an alternative, and that those people actually just don't call for help. And so while we hope that the main calls would be a diversion from the PD, that it would also generate additional calls that didn't exist before. And so I'm wondering, how do those folks reach you? Do you I know you all have your own number. Is it like an easy 911 number? Is there an easy way for people to reach you?
So we have our basic, our number, the 259-3370 number. Also, when we, so that is most direct, and that is how over 40% of our calls come through, is that people come in, they either call or they come in. And the other way is also we have our radios that they are cell phones, so that if we're out in the community and somebody has a difficulty or whatnot, we can give them a cell phone number that they can call us on. So we do have people that have called when they have difficulty for us to meet them someplace because they might have been trespassed from a building or they don't feel comfortable coming in, so we can meet them where they're at. And that is where the majority of our calls is meeting people in public where they're at or coming into the office. And also, I know one of the things was talked about was the overlap of CRESS and like police, fire, and rec. And it's not that it's an overlap, it is a collaboration effort between all of these departments, including town hall departments, where if someone is in need, they can call us and we can go out and be with them as a support for, say, when they need to call inspections or inspections is coming out, that type of thing.
Okay, thank you.
I am, Mandy, I don't know whether this is still a follow-up, but I'm also conscious of time, and we have fire,
Yeah.
another major department with us who have been extremely patient. So
This is a follow-up in a sense to exactly what Alicia was asking, Councilor Walker was asking. It seems like there might be two different missions or operational missions of CREST that you've been talking about. One of which might not actually really be in operation right now, which is the responding to situations that don't involve violence or serious crime that might otherwise require a police response a response from the PD. And then a second operational mission that seems to be maybe the more prevalent one here, which is the connecting people to services and resources. What I'm trying to do is get an idea of which percentage of calls, of these 500 calls, would you consider more, falling on the connecting people and to services and resources. And for example, your mention of driving people's to doctor's appointments and picking up medications for people, to me, would fall under that side. Since you mentioned those two, versus responding to situations that don't involve violence or serious crime that might otherwise require a response from the police department. Where's the split between those two in a rough estimate based on the 500 calls that you've had? It's hard to see that in the service level chart. And I'll give you an example of situations that don't involve violence that might otherwise require a response from the police department. That might include some of the situations you mentioned, I believe the library, where the library, instead of calling the police department on potentially an unhoused person that might be causing a little of the disturbance, they have begun calling you. I would put that on the otherwise PD side, just to give you an idea of where I would put the two on the mission. Is there a way you can either point to the service level chart and say, this is one, this is the other, or give us an estimate of where they fall?
Say that a majority of our calls are diversion, so it's direct and indirect diversion. So the calls where someone is having difficulty, they're in the street screaming, etc., and a business or a neighbor calls us, that would be a direct diversion. Okay. An indirect diversion would be somebody coming in who's having difficulty and they may be causing problems in other parts of like the bank's community center or outside. And we're able to sit with them and de-escalate the situation. And that also still is diversion. And another example I would give is that we received a call from the school about students, and I know this had happened recently about students that were fighting, and that is violence, that is a police call. However, in this case, there were two students that were worried were going to fight, okay, that were on a bus. And what Crest did is Crest met the bus after school when they got off, and we're able to de-escalate the situation, have conversation, and be able to be an ally to both the students and their parents, which prevented a fight, which prevented police from coming. So most of our work is diversion. It's just that when people talk about us being a social service agency, if you look at it, all public safety is social service. Okay, it's just how we operate and do it. Police and fire, their missions are go in, make a scene safe, and get out. Okay, ours is go in, make sure we're safe, and then make sure that people are seen, heard, and that get their needs met. And many of the times, these are the same people who don't have advocacy and don't have the autonomy to be able to go into situations and have their needs met and need someone to help them get those needs met or to be heard. And that's one of the things that people have said to us. This is the first time the town has come through for us. I feel heard.
Thank you.
If it's okay with everyone, can we shift to fire? And I think the lead off was a similar question that we've been asking about stress and staffing. So,
Yes,
and
is one of the
Andy,
things- is
and
one of the things
Andy, you can ask it more specifically or what, but thank you.
No, I want to thank the fire staff department for having been so patient and suggested next year the finance committee considers two separate times for people to come. But and I also want to congratulate, since I haven't seen you in a long time, Chief, for your move into the new position. And
Thank you.
The question that I wanted to start with all of the departments was there was a proposal to freeze position, and that came out of just the general budget stress that was the town manager was having to deal with. And so the question was, how will the freezing a position affect the department's ability to provide its essential services and cover shifts? And then sort of bridging into the second question of how the overtime budget and the use of the overtime budget fits into that.
Sure. So in terms of the the freezing of one of our positions, the bottom line in terms of us providing service, we have something called minimum staffing, which is how many firefighters have to physically show up for work for each shift. And that doesn't change. As we have less people to fill those shifts, what changes is the fact that we're running at minimum versus slightly higher, and we ultimately have more and more overtime. Hopefully most of the overtime is filled voluntarily, but when it's not, it is forced overtime. After somebody's worked 24 hours, they're told they can't go home, and that is not a good situation. We currently have on the books 6 vacant slots. One of those 6 is being proposed to be frozen. I don't want to spend too long out of here. I'm happy to answer questions. That 6 is a lot of what Chief Ting talked about. You could just substitute fire for police, and we're experiencing a lot of the same problems. Our shortcoming with our service is paramedics, availability of paramedics. There aren't enough paramedics out there in the world right now coming out of paramedic programs. We're trying to hire basic EMTs and train them to be paramedics. That is a 2-year process. So we're facing a lot of staffing challenges, which is why we have 6 vacancies. What 6 vacancies mean is we're running at minimum staffing more often. We have a lot more overtime and a lot more forced overtime. Looking at our overtime budget right now for this year, for fiscal year 25, which we're wrapping up, we are about we're about 50% over budget. We're $80 to $100,000 over our allotted amount of $237,000, and that is a very direct result of shifts being open. We have a couple people out on IOD, so they're not doing their shifts either. But you can imagine with our minimum staffing is 8. So Gabe talked about a shift being gone with 6 vacancies, 2 people on IOD. That's 8. That's a shift. So in terms, sort of answering both your questions, Andy, overtime, our budget, 237,000 this past fiscal year, it'll go up by 4%. We've already blown that out of the water, and we'll blow it out of the water again this coming year with that position freeze. The other significance of the position freeze is one is honestly recruitment. We just had a round of interviews for some new firefighters. We just did second round interviews for 2 promising candidates. And in the first round, one asked a question. In the second round, the other asked a question. I hear there are positions being frozen and eliminated. What does that mean to this position? You can't have a worse recruitment tool than freezing or eliminating positions. So this is as we try to struggle to compete with other communities and recruit qualified, talented staff, you can't do anything worse than this, because people obviously are scared to come in because they're scared for their position. Now, this is a freeze, not an elimination, but it's still scary to people. The other reality is a freeze of a position on a paramedic firefighter position is about an $80,000 to $90,000 investment. So when you say you're freezing a position, you're eliminating that from our budget. So whereas, I was at the town council meeting a few weeks ago where the town manager was basically told he has to do this. We're going to give 4% to the Jones Library. We're going to give X number of percents, more than 4% to the 2 school pieces of the equation, and the town. He then did a due diligence to keep our budget at 4%, the rest of the town, everything else, which includes public safety. So on paper, we have a 4% increase this year, which barely and probably does not keep up with inflation, the cost of everything going up. You take an $80,000 position out of that, that's a 1.5% cut in our budget. So in reality, we are not getting a 4% increase. We are getting a 2.5% increase. So that hurts. And that's going to be very difficult to keep up with. And in a way, and I'm in no way blaming the town manager, his hands were tied at that council meeting. He had to do this. We are not getting a 4% increase or a 4.8 or a 5.8 like the schools. We are getting a 2.5. And that's a reality. And that is going to affect our operation, Andy, well beyond our ability to put the staffing on the road.
Follow-up question, since which was a topic that I had brought up in the prepared questions also. You talk about the importance of meeting the minimum staffing that you need to cover shifts. Can you tell us a little bit of how the call force fits into that and the challenges in the call force side?
Sure. Without going too deep into our operations, although I'm happy to, I just want to be conscientious of time. We have a call force and a student force. I actually just gave this speech at a Rotary luncheon discussion a couple hours ago, so it's fresh in my head. Just a quick synopsis of how the department runs. So we have our minimum staffing of 8 full-time firefighter paramedics come to work each day, split between the 2 fire stations. They do the majority of the fire and EMS calls. When they are all out of the door, not available for calls, we have a matrix of either the student or call force, and actually calling in some full-time people from home to put people back in the station, right? So we have an engine ready to go out the door. We have a crew ready to go out the door. So our jumping to the student force for a second, which are very viable now. They're fully staffed and they're volunteers. We're not paying them. They nights and weekends during the school year provide an engine company of 4 people on the station. So if our full-time people are tied up, the student engine then becomes the station coverage, and they are available for calls, and they do go out on calls. Daytime when they're in classes, and all the off times, January, starting tomorrow with graduation, June, July, August, they're not available. They don't exist. So anytime we need station coverage when they're not available, those nights and weekends and throughout the summer, if we need more people to come in, we'll first put out the radio tones for the full-time people to come in. Sometimes a group of them will come in, sometimes they won't. If they do not fill the assignment, then the call force is called in. So the call force, to get to your question, is used for station coverage to come back in and man the station, staff the station, when the permanent force is all tied up. And of course, they're all called for fires like we just had on South Pleasant Street on Sunday, at UMass last night. They come in to provide additional companies to do the work, just like the student force does. The call force is an authorized strength of 24. They're currently running at about 12 because, again, it's a national trend. And even though they're not volunteers, they're paid part-time. Any type of, we'll call it a volunteer organization, because what they're paid is, it's token pay really. But what they do is struggling. You look at towns like Pelham, Leverett, Shutesbury, they are strictly paid part-time on-call fire departments. They have no full-time people. They are struggling for numbers, and our call force is no different. So the ability for the call force to pick up the slack, if that's where we're going with this discussion, is non-existent. They're there for a purpose that they've been used for decades. And given their reduced strength, they're not able to step in and fill any gaps created by full-time vacancies.
And I think I know the answer to this question, but be helpful for you to be providing the answer, and that is, can the call force do anything to assist with EMS calls?
For the most part, no. Our student and call firefighters, most of them are not, none of them are paramedics. A few are EMTs, not many. What we do is we run, if there is a pending medical call and all of our full-time people are tied up, none of our ambulances are available, we will send the student or call force on a fire engine as a EFR, emergency first responder. They will go and make initial patient contact, initiate patient care within the realm of their qualification. If they're a first responder, there's some very basic things they can do. If they're actually an EMT basic, there's a few more basic things. And then they're, of course, communicating to whatever ambulance is coming in. So they will not run an ambulance out the door. They will just make initial patient contact until we can put an ambulance by their side, which is either one of our ambulances coming back from the hospital or calling mutual aid from Hadley or Northampton or Belchertown or somebody else.
And I have one more question, then I'm going to see let other members of the committee take over. And that is that in the budget book and the presentation of goals for the department, there was reference made to the community paramedicine program. And I guess I'll combine the two questions, and that is, what would be the reason to make the expansion to a community paramedicine program as an additional initiative, given all that has already been said about the stress the department is under? And the second piece to that is, would it bring in additional money? Is there ability to bill to insurance, Medicare, Medicaid, that would bring in revenue?
Sure. I'm going to let Assistant Chief Olmsted answer that. Just two quick things I want to interject. Just back to your original question about what the call force does and coverages and things like that. I won't go into it now, but I'll just direct people to page 129. There's something there that says station coverages, and then it breaks it out by the three forces. That gives you an idea of how many times we are depleting our full-time force on any given day and calling in one of those forces. So that's on page 129. The second thing is I will let Assistant Chief Olmsted speak about the community paramedicine. My short answer is, when we're talking about reducing staff right now due to a freeze, there's little point in talking about increasing our staff for yet another program, but he can give you the Reader's Digest version of what that community paramedicine actually is and what someday it might be able to do for the town.
Good afternoon, everybody. So the community paramedicine concept goes back, a decade. It goes back to conversations that Captain Young brought up. It's another form of preventative public health care. If you look at the original documents that the town used to create CREST, it borrowed from the CAHOOTS program in Eugene, Oregon. And that program used paramedics or nurses mixed with a mental health professional in a standalone vehicle, not attached to shift, to provide care for folks sort of where they are. Not unlike sort of the model that we're using now with CREST and some of the CSO workings. So if you were to take one of our paramedics and took them off a shift and attach them to a CSO provider, that would be roughly what that would look like. And then they would try to do preventative follow-up care. It is just a different model. Unfortunately, to Andy's other question, currently Medicare is not paying for the ET3, as they call it, or community paramedicine programs, and we haven't seen the state provide ambulance services with broader discretion on where to transport a patient. We are only allowed to bring them essentially to a emergency department. So if you wanted to bring them to some kind of alternative care facilities, we don't have that kind of flexibility currently. And to make a community paramedic program, you would want that flexibility. You want to be able to take them to, say, a mental health facility or somewhere other than emergency department, because ultimately emergency departments are not the greatest or best place to take somebody with mental health problems, because those problems are chronic and they're really a lot better at dealing with acute issues. When the ambulance service gets involved with mental health cases, and I think, Captain Young probably didn't speak highly enough, I think, for all the mental health cases that the Amherst Police Department deals with on a daily basis. We are at the end of that string. They call us when things have broken down, when they haven't been able to figure out a better way to solve a problem. And they take care of probably, I think, Ron, we've talked, it's probably 80% more than we ever see. So we see a higher level of mental health cases that we transport, but the Amherst police officers are seeing that at a far greater rate, and they successfully deal with so many of those every day. So I hope that answered your question.
It does, and thank you. Kathy, I would yield to other members of the committee, of course.
Yeah, Mandy's hand is up, but I want to come back to the service level, because one of the things I'm looking at, the table you drew our attention to, is an increase in most lines, either a jump up in 22 that has stayed up, and in some cases, increase. So the patient contact, treat, no transport, a lot of things are up. So just some sense, is your sense is more calls are coming in?
Yes, they are. It was predictable that post-COVID, and it's going to be proven out, that we're going to do more calls, and we've seen that the community is getting busier. We've added more housing. We've got more people, and people call us for lots of things. So we will continue to see any decrease you saw was probably more related to COVID than it was anything else. We did see that slight decrease when we had the Hadley contract, that we no longer provided service there, and we sort of said, hey, beware, in 4 or 5 years, we're going to probably, based on our own volume of calls in Amherst, be back to that level. And it's proven out, and we've exceeded that at this point. So you will continue to see that to grow. And it speaks to, I think, the fact that the town is getting busier and getting bigger as far as population. The university continues to grow. Everyone's growing around us, and the impact of that growth is going to be seen by public safety and the social services.
Can you, I don't need you to do it now, but to what extent is the university, a major share? And I guess you get some seasonal, when you were saying that, the student force is not available in the summer, but the students aren't here in the summer. So hopefully some of the demand goes down in the summer. I don't know whether that's a true statement or not.
Somewhat. All of the schools have become busier during the summers. The days, 30 years ago, 31 years ago when I got here, of, school not in session and quiet nights have long since disappeared. All those entities need to maintain their viability, and programs and projects and people and research. All that happens all year round. So there certainly are less students, but the schools don't stop being busy in their own way. And the other thing that happens is we also start to see a lot of construction. So when do you repair colleges and universities? You do it when the students aren't there. So they work really hard to do a lot of work in about 3 months' time. And so if what we don't see on the Operational side, we catch on the prevention side. So there's a balance of all that.
And I would just add, what happens in the summer is our daytime, I'll call our base level, doesn't change year round. What changes, the students are active Thursday nights, Friday nights, Saturday nights, a lot of the activity. Obviously, they can have medical issues anytime, but our daytime call volume does not change much in the summer. It's the spikes that we don't see. And the other thing I would point out, I know you can't read any of this, but just you can see the bar graphs that I'm showing here.
Yeah.
I'm happy to share this with anybody down the road, but basically this is an age breakdown from infants to 65 plus, showing our annual call volume by age group. So there's two things to note. This is the college age, 18 to 25. That's about 1,000 calls a year ago. This is the 65 plus demographic, and that's 18 to 1,900 a year, so not quite double. So this is where a lot of our volume is from an age standpoint. This is where our highest growth level is. So the university and the colleges are part of our drive, but it's really townspeople. We're a growing senior population, and that's a national trend. And so this is where we're seeing our growth. So we can only blame so much, if you will, on the colleges. It is part of our story, but it's not the whole story.
That would be a very good graph for us to get. We'll put it in our report. Thank you. Just send it through to staff and we'll get it.
Sure, we'll get an updated one.
Thank you. I have two questions, one of which I'm going to phrase and you can just correct me if I'm wrong. Because I think I know the answer to this. So in the personnel services line, where the FTE has been frozen, but the change in personnel services is an actually positive change of nearly 6% in terms of the cost of personnel services for FY26. So the change from 25 to 26. I believe, if I'm correct, that's because the union contract was settled and some of that settlement increased something with union contracts, pay of some sort, whether that was the base pay or I'm not sure how it was, but is it correct that would be the reason why, despite an FTE change, an FTE freeze, that the personnel services line is increasing by 6%?
Yeah, pretty much 100%. That's the answer. A new collective bargaining agreement was just signed in the last month. That's retroactive for FY25, carries in FY26 and 7. Some respectable and much needed raises for all levels of our firefighter paramedics. So that's accounting for virtually all of that. That line item does not include overtime. That is a separate line item that I referenced earlier. So what you're seeing is essentially all the wages for the fire department.
Thank you. And I don't want my question to be seen as like saying that was a bad agreement or anything. I just wanted, as we look at numbers going up, that was one of the higher ones. And so I just wanted to confirm that was the reason. I'm glad it's a settled contract at this point.
And just I'm you're the finance committee. I'm preaching to the finance committee, but just to be clear, with unfilled positions, except for the frozen one, even though they're unfilled, that money is still in our budget. So as our overtime budget does this, we're at least able to infuse, on paper, the open positions are helping cover that. When we cut a position, that 1.5% cut in our budget, now our ability to balance our budget at the end of the year is now cut right by that 1.5%, because we're still going to have the overtime. In fact, the overtime is going to grow, but we actually have now less money to buffer that. So.
Thank you for that explanation. The next question I have is on the service calls levels. And I'm actually going to ask about the fire calls. It appears that the false accidental calls are increasing. 10, 12%, something like that. Approximately by the same, like that false accidental call increase is basically driving the total fire calls increasing at this point. Is there a way we can minimize the false calls, the accidental calls? Is there a way to address that to give you guys a little
I'll take that one. I'll take that one on. So I said a little bit earlier, we have more people because we built more buildings. We have more apartment complexes. Each one of those has up-to-date current fire protection, including fire alarms and sprinklers. That also means we have more opportunities for false alarms, cooking. And in addition to that, in the last 9-ish years, we have added something in the late neighborhood of 11 to 1,200 additional units of up-to-date fire alarms into older and existing apartment complexes to meet the requirements of Mass General Law 14826C that was mandated by the state fire marshal. So what that means is, in simple terms, is the old battery operated smoke detector that was in those units for decades and in certain places wasn't supposed to be there. And then in fact, a hardwired interconnected fire alarm system was required to be there. And it wasn't done. It wasn't upgraded beginning in 1979. So we went back to the Rolling Greens and the Boulders, Brandywine, and a number of other complexes, and basically had to provide them documentation to show that they were required to bring their apartment complexes up to the proper code. And inevitably, Colonial Village, inevitably, we're doing more fire alarms because of it. So on the one hand, we provided better fire safety. On the other hand, we have more opportunities for cooking smoke, occasionally some showers, some cigarette smoking, and even just a learning curve when somebody lives in an apartment and they can just take a battery out of a smoke detector because it was annoying them. The hardwired interconnected system doesn't provide them quite the same luxury. And so some of it's a learning curve in education for the folks that have a new system. So some of that is we've done really good fire prevention work and it has an operational output.
So if I understood correctly, my house has battery operated. If it goes off because I'm cooking horribly and burn something, you guys don't get called unless I call you.
Correct.
So that accidental going off doesn't affect you, but all these updated ones, you would automatically get the call in something like that?
Mostly if they hit the common areas like the hallways or the basements. So there are some that are intertwined depending on how they set up their systems. That could happen just because of the apartment notification. It really depends on how they design the system.
I would just add, not to be confused, if you're talking about a single family house, Mandy, unless
I
you're
know
paying
for me, but
yeah,
in an apartment.
so unless
yeah.
unless you're paying an alarm company, then no, the fire department doesn't get called. Primarily what Jeff was talking about of all this new construction are not homes. There are all these 5-story buildings in town. It's the new buildings on the UMass campus, the partnership with private builders, as well as some upgrades to roll, places like Brittany Boulders and places like that. So these are apartment complexes, which by code have to be monitored. So yes, when you burn your dinner and it gets out of the hall, or if it's a newer system in your apartment itself, that's automatically calling the fire department. That's what he's talking about.
Yeah, no, I just want to make sure I understood that distinction, and
Yeah,
prior to those upgrades, they didn't automatically call the fire department.
Correct. It's definitely not your 1 and 2 family residentials. It is all large apartment buildings.
Okay. So there's not huge, other than fire education, not a huge opportunity to reduce those too much. And in fact, as we build more apartment buildings, we might actually see an increase in those false and accidental alarms.
Yes. So if I said earlier, if you add more people, you have more impact on public safety. If you put more people closer together and build them up, you have to have other protection mechanisms to protect them. And the unintended consequence of that is that you're more likely to have fire alarms.
Thank you.
That's why some towns have an impact fee when the big building goes up. It's to pay for the fire safety.
It's really more for when you don't maintain them and we go.
Yeah,
So
yeah.
this is an accidental. You did something and you accidentally set it off, as opposed to a owner or property manager who purposely I don't want to take care of this system. I don't want to maintain it. I don't want to have it inspected. And now we're going because of their purposeful efforts to not take care of their equipment.
Yeah.
That's really where those fees come from.
And there are sites that have really taken corrective action too. We are working to reduce them. The engine companies actually sometimes spend time at these sites educating folks. We have one property, I bet you they were 10 times in the first 45 days They've probably been 10 times in the last 6 months. And it's partially because the engine company stayed, they educated them, talked about how their HVAC systems work. We worked with some of the property managers. Some has been reduced. But as new come along, right, there's a learning curve again.
Wow.
Is reflective of the overall work that the department does. It may
Yeah.
not always be the flashiest thing. It may not be always be the most direct patient care thing, but it is reflective of what the department does as a whole.
Well, and that was one of the ones when I first was looking at this, at Applewood or the Arbors, where you're called to help someone stand up, as opposed to take them to the emergency room because they don't have a staff that feels they can, if someone falls, they're not injured necessarily. What did you had a special name for it? I can't remember what it was, but it was.
Those assisted living, facilities like the Arbors live in a very interesting regulatory and code place. And they have minimal requirements by the state. And so we see a lot of different call types there. And we've seen a growing number of, more acutely ill patients, more in line with what we used to see in, say, Center for Extended Care in a nursing home. They've taken on a bigger role, but there is, as the chief showed you, that list of people in ages, it is reflective of the fact that we need to have those kind of facilities to provide assisted living and long-term care, because as much as we want people to be able to live in their homes as long as possible, that at some point comes to some kind of conclusion, and that this is the best way that people have figured out how to care for folks. They need it in a group format. They just can't live independently.
Yeah, and actually, when this was first mentioned a few years ago, I went and looked at the legislation, the regulations for assisted living, and I was extremely surprised that they're not required to train people how to lift, to pick someone up, because as
Not
opposed
that
to opposed to Applewood, which is more independent living, they
And
have.
those folks are better able to take care of themselves at Applewood
Right.
generally. Like they're
Yeah.
healthier. And then it's not always about the training necessarily, but it's about the fact that no one wants the risk of lifting someone. And
Right.
our whole world around us has gotten heavier, not lighter. So no one wants to go, they don't want to go to work and get hurt either.
Right. No, I
really-
understand that. Yeah.
That's their liability.
Well, and that's always been I have a health regulation in my other life, but nursing homes, that was one of the injuries that were regular with AIDS, back injuries from lifting people, because they didn't have the apparatus to help, or they didn't have enough staff. Yeah. So, but Mandy, if you look at the big increases, that's a big increase, go there, but don't transport. It's a visit, but don't transport anywhere. Yeah. So anything else that we should know? And I do thank you for the amount of effort that goes into giving us these budget book pages. They're very helpful. We do look over all those tables that you provided to us.
Sure, it might, if we're gonna send you over that demographic breakdown by age, we'll also send you this pie chart, which gives you a really nice breakdown of EMS types of calls and fire types of calls as percentage of our total calls, which kind of more clearly, I think, answers some of the questions you were just asking about where all these actual calls are coming from.
Thank you. Andy?
Yeah, just one quick additional question, Chief. You had mentioned earlier in the presentation about not the limitation of people who work for the department that are not actually EMS qualified to respond to calls. Isn't there a large risk of sending people, of not having people available because something can always be so much of an emergency that it's life-threatening to not have the best qualified people there at the start of the call?
Yeah, I'm not sure your exact question. So yeah, obviously we want to put a paramedic level ambulance next to somebody's side as quickly as possible if they're having any kind of medical emergency. That's key, but I'm not sure what your question is about using the other people when we have to.
Yeah, I guess it was a question as to how frequently is that happening, and is there a large number of people who are being put at risk because you have to make that decision at times?
Yeah, I mean, again, we run a paramedic level ambulance service here, so all our ambulances that go out the door are at the paramedic level, which is the highest level of care you can get. When those 3 ambulances, we have run 3 at any given time, are tied up, then we have to do the next step back, which is if we have a full-time firefighter still available, 1 or 2, then they can jump on engine 1 or engine 2, which are set up as paramedic fire engines. They have some of the basic equipment. Then they would respond. So you're putting a paramedic with a lot of the critical gear, heart monitors, ability to do, cardiac issues, medications, etc. You're actually putting, in a way, an ambulance next to the patient's side, but with a fire truck. So obviously they can't transport, but they can initiate some very high-level paramedic care. So that's our next fallback. And then if they're all tied up, then we have to do 2 things. We have to send the caller student force, and which is what you're referring to. And then we call for either an ambulance to come back from the hospital or a mutual aid ambulance. To put a number on it, if you go back to that chart on page 129, there is a line item there about 2/3 of the way down that says mutual aid ambulance into Amherst. So in FY24, that was 141 times. So that's 141 times we had to call another town to come do one of our medical emergencies. And then there's a number I don't have on this piece of paper, I don't believe, which is how many times we sent a fire engine without paramedics to a call, and then an Amherst ambulance came, if that makes sense. So in any case where there's no Amherst ambulance available, we'll send a fire engine, ideally with a paramedic. But if it's a student or call force without a paramedic, then a certain percentage of those calls, 141 times last year, another town came and covered it because we couldn't get any of ours back in time. Then there's another number out there where our ambulance raced back from Coy-Dixon Hospital or somewhere and handled the call. So the number is actually greater than 141. 141 is the minimum.
Thank you.
So I'm very conscious of time, and you all have been fabulous because we are past 6 o'clock, which is already a late time for everyone. So I'm not seeing any other hands, and to the extent we have any follow-up questions, we'll send them through to make sure we heard what we heard accurately. And if you feel like there's any information we should have that we don't already have, these charts would be very helpful. So anyone else, I'm just looking around the screen of the committee on any other hands. Bob?
I just wanted to thank all of you for your service to the town. And, we tend not to, we focus as a committee on asking hard questions, but don't misinterpret our fervor in the questions with anything other than huge respect for all of you and for the work you do. Thank you.
Thank you. Appreciate it.
Appreciate it. Thank you.
No, definitely. And these tables showing about how much you do are awe-inspiring. So I think with that, we're ready to adjourn, and you all can just leave. We've got a practice of voting to adjourn just to make sure we've agreed that we're adjourning. But I want to thank you all for staying with us and bearing with us both. Thank you very much. And for everyone on the screen, you can just click leave the thing and we'll.
Thank you.
And I'll make a motion to adjourn.
Second.
Thank you for your
Thank
time.
you.
Thank
Bye,
you.
everyone. Thank you.
Bye.
And I'll put it to a vote. Mandy?
Aye.
Kathy's a yes. Bob?
Aye.
Andy?
Yes.
Tom?
I concur.
Alicia?
Yes.
Well, this was a lot to think about, and thank you all for your patience. The next Thursday meetings are all at 9 o'clock, just so that there's no confusion. We've dealt with the TSO overlap, which only happened once in the month of May. So we will, and if anyone doesn't know what we're doing next, just email me and I'll send the schedule back out. So thank you, everyone. We are adjourned at 6:11.